I'm Anand Malaviya. I'm retired head of the Department of Medicine of All India Institute of Medical Sciences, New Delhi. I started and initiated the subject of rheumatology in the country long ago when I joined the All India Institute in 1968. Since then, I worked upon clinical immunology and rheumatology to establish this field. And so people have started calling me father of rheumatology and clinical immunology. Now, regarding one subject that you have asked, that is gout. Gout, long ago, it used to be the disease of rich people, those who don't do any exercise and eat excessively and become heavy and overweight. They started getting acute pains during night time in their foot. And this used to become red hot and so painful that they will really cry with this pain. Recently, now the disease with ample of food available all over countries that were the second world countries or developing countries like India, but with the food available all over and improving socioeconomic status, they have also is overeating, and unfortunately fast food joints have spoiled the whole thing, and all kind of unhealthy drinks and unhealthy food. This has led to obesity. People are getting heavy, and they have forgotten our main lifestyle of doing exercises and walking. They have forgotten all that, and they have all become round. Their paunches are big and they are heavy. They start getting gout. And now, therefore, in India, if you have somebody coming in casualty at 2 a.m. in the morning with severe pain in big base of the big toe, then the condition is called gout, and that straight away should be sent to a rheumatologist for appropriate treatment. And the gout can be managed. Acute gout can be managed immediately with important medicines. Once that has happened, then we have to then tell them for a long term lifetime management. Number one, reducing weight, changing habit of living, going more for exercises, and proper medicines to keep a certain thing in the body under control, in which cholesterol is the most important. By reducing weight and balanced diet and correct diet and plant-based diet, gout-related issues in the heart will also be controlled. And so this should be kept in mind, that people keep on talking uric acid, uric acid. That is a very big mistake. Uric acid actually is a watchman of the body. When uric acid starts going up, it is indicating that, sir or madam, you are not doing the right life, you are not following the right lifestyle. You are eating too much and you are not doing exercise. You will develop diabetes, blood pressure, heart disease, and you will have acute gouty attack also. The moment you start taking lots of salads and fruits and go on vegetable diet and do lot of exercises, take plenty of milk and paneer and dahi, suddenly you will find your uric acid goes down without treatment, and gouty attacks will become less and less. But there are people who have reached a stage where continuous treatment will keep them better. But for that, they have to consult a rheumatologist like me.
One thing also, is gout, like you said, gout is manageable but curable, not curable.
There is no disease I know that is curable except some infection or early cancer. These two diseases are in the whole to 20,000 diseases that we know of. There's only two diseases that are curable. Infection. With you give antibiotic, you treat even tuberculosis, leprosy, they are infections, they will be treated. Or cancer. Early cancer, you detect it, cut it off by surgery, and the person is cured. Name any other disease. You take thyroid, you take blood pressure,
And
you take
CDS, you mean
diabetes,
to say
you take.
non-communicable diseases
They
are
are
just
all
manageable but not
manageable.
curable.
Patient can live normal life if they follow the lifestyle. The heart diseases and blood pressure and diabetes are manageable, and person can live a healthy life, reaching 100 years without any difficulty.
And do you see that gout is now among, the age is going down for gouts?
Gout, till now, it is extremely uncommon below 40 years of age. Usually, it occurs in 50s and 60s. But yes, you are right. We have started seeing people in early 50s also. And I recently saw a case who was 45 years of age. So these are uncommon things, and mostly it is a bad lifestyle that we are getting into. And we are leaving the plant based food and exercises and remaining slim and trim and active. If we do that, and alcohol is playing a very bad role in this.
Okay.
Too much alcohol, which is also very, very bad for health.
Smoking?
Smoking is poison. I really tell, if we can stop the production of tobacco in the world, 50% of the hospitals in the world will be closed, because 50% of the diseases directly or indirectly are related to smoking.